up? It's Courtney the RN and I'm back with another video. Today we're going to be talking about how to gain confidence as a new grad nurse and the do's and the don'ts. All the tips that you need when you first start. Stay tuned. So number one, always ask questions. I always go to my charge nurse for all the questions that I may have, and I always come with a solution that I made up with my own critical thinking. Don't ever go to your charge nurse asking, what do I do? Looking at him like, oh, what should I do? Like, no, we're not doing that. We're coming with a conclusion already, and that's when they add their 2 cents in what we should and should not do. But don't ever come asking blatantly, what should you do? You are a registered nurse now. You need to have some type of formula, critical thinking going on to propose to your charge nurse if you do have a question. Number 2, be confident. If you gotta fake it a little bit, you gonna have to, because when you go in and you have confidence, then you do everything better. Even if it's a skill that you're not too good at, when you go in, you're like, okay, I got it. You perform way better. But if you go in like, oh, I don't know what I'm doing, and you psych yourself out, you're gonna do terrible. You're going to do terrible, and the patient gonna be looking at you like you crazy and you don't know what you're doing, and we don't want that. So you walk in like you did it 100 times before, and when you fake it till you make it, sometimes you do amazing, and you shock your own self. Like, dang, I did that. Like, for example, let me show you. Today, my coworker, she's like, Courtney, can you come put an IV in for me? Like, I missed it. I tried so many times and I keep missing. Knowing me, I don't like IVs. I always ask people for help for IVs. Nobody asked me for help, but she did. So I'm like, okay. I walk in, I'm like, you got my supplies ready? Okay, boom, boom, boom. Got up in there, ta-da, flashback, ba-ba-ba. Got that thing first try, because I went in with confidence. I didn't see not one vein, but I felt it though. But usually I like to see the veins. But I went in there with confidence. The patient, she felt comfortable because I looked like I knew what I was doing, and I performed well. So when you go in with confidence, you do great. Even other skills that I used to do that I never seen before or was a little rusty at, I walked in like I did it 100 times and I ended up getting it the first time. Confidence makes you perform better. So have it, please. Don't be coming in there looking all shook and scared, because nobody likes that, especially the patient. 3, take your time. I know it's gonna sound like I'm contradicting myself when I say have time management and then I'm saying take your time. When I say take your time, don't be in there rushing around doing all this. It's like you're not getting anything done like that. Like, you're not being efficient just because it looked like you moving fast. Like that one video, he gets down, he don't play. Like,
and he gets down fast, he don't play.
Like, he moving, but he ain't really doing nothing. So me personally, I walk in the patient's room, I take my time doing things, because when I take my time, I move faster. I pay more attention to detail, because when you moving too fast, especially if you new, you're gonna be missing stuff, and you can't afford to be missing stuff. You're not that experienced yet to be moving all extra fast for no reason. And sometimes when I see nurses move fast, I'm just like, boo, you not even sterile no more during a sterile technique because you're trying to move all fast. You're dropping stuff because you're moving fast. It's just take your time, and that's how you be more efficient, not because you're moving fast, because really you really not really doing nothing for real. Like, just calm down just a little bit, okay? Number 4, protect your license. You are a licensed registered nurse now. You need to protect your license. When you get a report from the incoming nurse or the outgoing nurse, take it with a grain of salt. Do not believe everything that this nurse says, because half the time they don't know what they're doing, or they don't know what they're talking about. They could say this patient has bilateral pedal pulses, but they have an above the knee amputation upon your assessment. How you got 2 pulses and you missing a leg? Can you please let me know? Huh? Some of these nurses don't know they left from they right, saying the IV is on this side and it's really on that side, saying that a pressure injury is on this side but it's really on that side. Like, are you really being thorough in your assessment? Are you just telling me anything? Sometimes you'll get on shift and nurses are stumbling across their words. They don't got nothing on their report sheet. They just passing down the same report, and the same report be wrong. Report is like a game of telephone, especially if that patient is there for a long time. It's like a game of telephone. So you know how telephone, you start off with one sentence, and once it gets to the 10th person, it's a whole different sentence, or stuff is left out, or some is added and it's not true. That's what report is. So do your own report and do your own assessment and be thorough, please. For example, at the beginning of your shift, you're seeing your baseline of the patient, right? So you go in and they're cool, they're speaking clearly, they're A&O ×4, they know the place, the date, the time, their birthday, their name, why they're here, all that stuff. They're good. You check their strength from their grips of their hands. It's perfect, +5, equal grips and everything, right? Middle of the shift, the patient's slurring their words. Their right side is drooping. Their right grip is not strong as it was at the beginning of the shift. You would know that because you did your initial assessment, right? So say you didn't, right? In the middle of the shift, this is happening and you can't tell the difference. You know the first thing your lead nurse is gonna ask? The RRT team, the code blue team, what was their baseline? Were they A&O ×3? Were their grips weak or strong? What were their respirations like? What do their lung sounds sound like? Say you half did your job and not do your assessment and you went based off what the other nurses were saying and you really don't know. And they gonna know that you don't know because you're gonna start stumbling over your words, and the last thing you wanna do is play with somebody's life. Do your initial assessment so you can get a baseline from your perspective, not somebody else's perspective, okay? And if you don't see it, you don't chart it. Just because you heard them say it, don't mean it's true. For example, I got a report on this one patient. Everything was perfect with this patient, but when I do my initial assessment, I look and I'm like, you're breathing kind of hard and fast. But all day, they was just a perfect angel, right? So when I see that they're having respiratory issues, I count the respirations for the whole entire minute. That is my job to do, okay? My assessment. So I'm counting for the whole minute and their respirations are 30. So I'm like, okay. So I look at the trend throughout the day and I see a 17, 18, 19 respirations and stuff like that within normal range. But when I get there, it's 32. I'm not understanding how this just happened all of a sudden, right? So I get my charge nurse, he comes, he counts the respirations as well, and it's also 32, 30 and stuff like that. We call a rapid response because what is going on? This person's ABGs were off the charts. They had to be transferred off the unit to a more intensive unit. That respiration count that I counted 30, 32 was not nothing new. It wasn't something that just happened. It was something that happened throughout the day, but the other nurses were just charting the regular schmegular stuff, not doing their initial assessment or not doing the assessment at all. Do your own stuff, okay? Do your own assessment and make sure you have a baseline, because you're clocked in now. They're at home sleep. You're here now. You got to deal with it, okay? Number 5, learn how to prioritize and delegate. So at the beginning of the shift, you're getting your report and you're doing a bedside report with each patient. And when you're getting these reports, you're already formulating in your head, oh, this person I need to see first. Oh, this person is my most stable. I don't need to get to them first. So you're basing your acuity off of these bedside reports. So when you sit down, you're writing down the vital signs, the meds of everybody, and you're just formulating and planning your night, right? So when you go in the patient's room with the medication, this is when you set your boundaries and you tell them how this is going to go. Because it's very easy to get sidetracked and have them get you sidetracked by asking for some orange juice or asking for a blanket or saying that they're soiled and they need a bed bath right now. But you're at the beginning of your shift where you're the busiest, right? And you need to pass these meds. You need to do all your assessment on all of your patients. And some people have 4 patients, some people have up to 6 patients. So right now, that's not your priority, trying to get somebody some orange juice and a blanket. It's really not. That's when you delegate, right? Walk in, you set your boundaries. Hey, my name's Courtney. I'm going to be your nurse today. I have your medications. So I'm going to pass you these medications and I'm going to do a quick head to toe assessment on you. I'm listening to your heart, your lungs, look at your skin and everything of that nature, right? And they're going to be like, okay. So at that point, they're just like, okay, let me not ask about anything right now. Let me let her do what she has to do. But if you just come in, they're going to start off the bat. Oh, I'm a little cold. Can I have a warm blanket, please? Or I'm a little thirsty. Can I have another orange juice, please? And you're just like, okay, I'll go get that for you. As a new grad, I'll go get it for you. I'll go get it for you. But it's just like, you don't have time to do that. You have 4 other patients to see. that can wait. That's not your priority at this time. That's when you delegate to your CNA or your patient care tech, whatever they call them at your facility. That's when you're like, hey, can you go get this patient a blanket real quick? I'm doing my assessment and passing my meds. And they'll go get it for you. Or if your CNA is busy, right? You tell the patient, I'll get that right after I'm done with this. Because you're not gonna be having a cover on when I'm uncovering you and looking at your skin and doing my assessment. So it really don't matter. You need to set your boundaries and have the patient wait if they need to, because you need to do what you need to do. You're running the show right now, not the patient, especially if it's nothing important. And of course, sometimes family members and patients do get upset when you don't do things right then and there for them, but they have to understand that there's more going on beyond their four walls and their room. They tend to think that they're the only patient that you're taking care of, and that's not the fact. I personally don't bring up other patients or how heavy my load is. I just tell them I'm doing the best I can and I will get right back to you when I have time. It's not because I don't want to do it. It's not because I think I'm too good to clean up a soiled patient or too good to get a blanket or too good to get some orange juice. No, that's not the fact. I help my CNAs out all the time. But if I do not have the time, I cannot do it because I have other things to do and prioritize. Here's an example of delegation I found very funny from a day shift nurse. So yesterday I was giving a report to the day shift nurse because I was going home, and this patient did not like their food, their breakfast. So the patient asked the nurse like, hey, can you help me order some more food? And she says, I won't be doing that, but I will have my aide do it, okay? Because I have to give you blood and I have to start my shift. I have to get eyes on my other patients. So as a new grad, you'll be like, oh, okay, I'll help you order your food, when in reality there's another worker that can do that for you while you do other things that matter or that's more important. Delegate, okay? Because as a new grad, I would have helped that patient order some food, taking up my time at the most heightened, intense portion of my shift, which is the beginning where I have to pass meds and assess my patients. I would have been ordering food when I could have delegated that task to somebody else. So learn how to do that. So my problem with delegation at the beginning when I was a new grad nurse was I felt awkward telling another grown person what to do, especially if they were older than me. And I also felt awkward telling somebody what to do when I just got there. Like, I just started this new grad residency and now I'm telling people who've been here 10 years, oh, can you go do this? Or, oh, can you go do that? I just felt weird doing that. And you're not supposed to think that way. We're all here to help the patient. So if you feel like that, please don't. Or just get used to it, because now I'm asking left and right, can I get help from the CNA? And I help my CNAs as well. I don't delegate everything to them, but if I am backed up or I cannot do it, I do delegate. But if I can do it and they're busy, I will be more than happy to. Number 6, I think I forgot, but number 6, chart thoroughly and correctly. So say for example, you're being investigated or you're going to court for some odd reason. A couple years from now, you're not going to remember these patients, but you remember them now. So make sure you're charting everything correctly and precisely and everything that's happening in real time, because if you ever have to go to court for some reason, if the hospital's being sued, you need to know what happened that day, and you're not going to remember, but those notes will help you recall everything. So I saw something on TikTok, it was kind of controversial, saying, oh, you need to chart vaguely because if you go to court, they can twist and turn your words, so make sure you chart vague. And then I was taught to chart thoroughly because that's just what you need to do. Like, if you're charting correctly, honestly, and thoroughly, I feel like you can't be manipulated. Like, that's what happened. Just don't add too much extras where it can be confusing, but do tell the truth and do chart what you did. Because if you chart vague, then it looks like you didn't do nothing. Like, you just didn't do anything. So I'd rather chart thorough and cover myself than chart vague and it can be open for anything. So you do what you want with that. Don'ts. Try not to have imposter syndrome and try not to overthink. Sometimes nursing will have you thinking like, do I really want to do this? Like, I went through nursing school to go through this. I don't belong here. I'm not smart enough. In reality, you are smart enough. You do belong here. you went through nursing school to do exactly what you had a passion for, which is taking care of your patients. And it may be shaky at first, it might be frightening because this is something new, it's a new step in life, you have a career now, but you will make it through. It's like riding a bike. When you ride a bike, you kind of shaky at first, but once you get to riding, you riding. Or when you first learned to drive your car, you didn't know what you was doing, now you slaying shit, okay? So you will get used to it. It just takes time and practice, but you do belong here. So do not overthink and do not think that you're not supposed to be here. You are. You will make mistakes, and that is okay. Try not to take nobody's life, but you will make mistakes, and that's how you learn. Think of it as a positive thing. So the next time you do that certain task or that certain skill, you would know not to do what you did before, and you would know the correct way to do it. So when you make mistakes, don't beat yourself up about it. It's like not that big of a deal. Like, it's going to happen. It's inevitable. We all make mistakes. We are human. We are not perfect. Don't beat yourself up about it. Do not be overly confident. I know I said be confident, but don't be overly confident where you over here talking about, well, I read in the med-surg book that you're not supposed to do this and this, that, and the third. Don't be questioning people. Don't be saying they doing stuff wrong because of what you read in that med-surg textbook, because that is not real life, okay? It's a perfect scenario and things are not perfect in real life. Please don't do that. Don't be one of them, okay? Because the med-surg textbook does not show you the policies and procedures on what your hospital is doing. It doesn't show you what happens in the real life. It shows you the perfect scenario and the first medical intervention you do, it works. Like, no, that's not real life. So don't be one of them, and make sure you still ask your questions and is eager to learn and not think that you know everything, because you really don't. Going hand in hand with being overly confident, don't try to take things into your own hands and think that you can do things by yourself and you're really not 100% sure of what you're doing. I know you want to be proactive, but don't start doing things and you guessing, trying to show off. Like, no, please don't do that, because these are actual patient lives. This is not practice, babes. This is you doing it for real. So don't be trying to show off and do certain things and it's wrong. Like, please don't. Do not cut corners. This goes back to being thorough. Make sure you are thorough and not cutting corners. Don't say to yourself, oh, that's not important, I'm not going to do that, because if shit hit the fan later, you're going to wish you did that one thing that you cut a corner on. Please don't do that. Please. So I know I said take your time earlier, but don't be late either. Okay? Take your time, but don't be late. There's certain medications, for example, that cannot be late. One of them being leucovorin is for methotrexate levels. So that can't be given 30 minutes early. It can't be given 30 minutes late. It needs to be right on time. And you need to push it for 3 minutes straight, slowly. So if you need to set a timer, that's what you need to do. Or vancomycin, you can only give it 30 minutes early, but you cannot give it 30 minutes late. That's an antibiotic. Make sure that is on time. Or anti-organ rejection medications. If they got an organ transplant and they take medication so their body won't reject it, that needs to be on time every single day. So if you're too busy giving bed baths per patient request when you can delegate that task, and you're late giving one of those medications, what are you doing? You can't do that. Or if you're over here going left and right getting blankets and juices for patients and you got stuff to do, you can't do that. Or if you're sitting there talking to a patient because you don't know how to cut them off, you can't do that. So you need to make sure you know how to prioritize your time and delegate and be task efficient, and not just lollygagging around and trying to do everything yourself when you just can't. You are one person and you got 5 to 6 patients, 4 to 6 patients. You just can't do it. So time manage and make sure that you know at the beginning of the shift that you have all these meds to give, or you have all these prioritizations and acuities. Make sure you know that at the beginning of the shift, because there's no excuses when you got to call pharmacy and say, oh, this is 2 hours late, I'm sorry. Fuck, like, what did you want? But not least, I don't know what number this is, but do not take what these patients say or do to heart. Leave your feelings at the door. Some people are blatantly rude, and some people are just annoyed because we're just strangers. Us nurses, we're just strangers looking at their body parts, twisting and turning them, taking their vital signs every couple hours, poking and prying them, poking their fingers for blood glucose checks, giving them medications. They going down to procedures, CAT scans, MRIs, x-rays. Like, we keep coming in and out. They eating nasty hospital food. It's like so many factors of what can make these patients annoyed. They're sick, they have cancer, they don't feel good, they're in pain, and you mad because they got an attitude with you. Like, just keep it at a minimum when you go in, but don't be going in there rolling your eyes and getting the attitude back and clapping back like you are not on the streets. You are at work. Like, please don't be one of them, you know? And you can say like, hey, I don't appreciate how you're speaking to me right now. Can we have some mutual type of respect? That's a good way to get somebody in check professionally. And if they still popping off at the mouth or just being so verbally abusive where you can't take it anymore, go to your charge nurse or go to your manager. But do not sit there and go head to toe with a patient like you out on the streets. Because trust me, I gets down, I don't play outside, but at work, I'm not letting you get to me that way. Like, I'm leaving my feelings at the door. And it just don't get to me. Like, just take that under consideration with patients, okay? That's it for my video. Thank you for watching. Those were my do's and don'ts and all my tips for new grad nurses to get acclimated in the atmosphere that they are getting into and the career. So I hope it was very informative for you. These are all based off personal scenarios and what I learned during my new grad residency and what I've learned so far being a new grad. So stay tuned for my next video. I don't know what it's gonna be. I'll put it in the caption below, the description of what the next video is gonna be. But like, comment, and subscribe. Peace.